All right, y'all. Welcome. I'm going to get us started. I'm so excited to be here with you this morning for our resilience presentation series that's hosted by ETSU and Ballad Health Strong Brain Institute. I see y'all are introducing yourselves. I'm glad you're doing it. Put your name in the chat box, what you do, where you work, any other things you want to put about yourself. If you want to be added to the Strong Brain Institute's listserv, please do put your email address over there as well. I'm Diana Moreland. I'm an associate professor in the Department of Psychology here at ETSU and then the Associate Director of Training, Implementation, and Dissemination for the Strong Brain Institute. The Strong Brain Institute, or SBI for short, was founded by a $1 million 5-year gift to ETSU from Ballad Health. And I'm honored to get to be a part of the leadership team that's helping to lead and grow this organization. The majority of Americans have experienced at least one major adverse childhood experience at some point. And at ETSU specifically, 1 in 4 of our students have lived through and still may be living through adversity, and specifically 3 or more major adverse events. So the goal of the Strong Brain Institute is to use the science of childhood adversity coupled with mitigation and prevention science and resilience science to really prevent ACEs, raise the awareness of ACEs, help break the intergenerational transmission of risk related to ACEs, and of course, promote resilience and positive childhood experiences for folks in the Appalachian Highlands and beyond. So we really love being a resource for people in our region, communities, and state, and really our nation now, when they have questions about how to best employ resilience-informed strategies and practices in their work. So without further ado, I'm delighted to introduce our all-star speaker lineup for today. We have April Scott, who is with Centerstone. She's the prenatal, infant, and early childhood program manager there. April's been with Centerstone for over 17 years, developing prenatal, infant, and early childhood services and systems with a multi-generational approach to promote equitable, positive childhood experiences that can prevent and mitigate adverse childhood experiences and halt the intergenerational cycles of trauma. She co-leads the Resiliency Project, which is a collective impact initiative that provides community education and support to increase protective factors and equitable access to services that promote positive childhood experiences in Tennessee. April, I'm glad you're here. Next, I'll introduce Rachel Hanson, who is the project director and Healthy Start Tennessee of the Healthy Start Tennessee program with Centerstone. Rachel oversees program activities and grant requirements, as well as facilitating collective impact among partners, agencies, and community members. She has also served as a care coordinator and in-home therapist and specializes in perinatal mood disorders. She has worked in the community and mental health work for over 13 years. She serves on the board for Postpartum Support International Tennessee, and as an adjunct faculty at Columbia State Community College. So happy to have you, Rachel. Last but never least is Kimberly Ladd, the co-chair to the Resiliency Project, which is backbone by Centerstone. Kimberly, with Aligned Hope, is an advocate for child and family whole being, is a facilitator for health outcomes from positive experiences. Hope, that's what y'all are here to hear about today. And she's a certified prevention specialist. Kimberly challenges systems, communities, and faith-based organizations to reflect upstream when engaging with families and children by prioritizing prevention with a shared vision for hope and community resilience. Y'all, we are honored and privileged to get to hear from these women today. Thank you all so much for being here, and I will turn it over to our speakers.
I am going to get this launched. Does that look good? Everybody see it? Okay. You never know with technology, so I just want to make sure. Again, thank you so much, Diana, for that welcome. We are so blessed and grateful to be here today. As she said, my name is Rachel Hanson, and I'm going to be here along with April Scott with Centerstone and Kimberly Ladd with Aligned Hope. And today we're going to discuss healthy outcomes from positive experiences. So we're going to start with this slide right here. And I'm going to ask you, feel free to unmute or use the chat box. But what risk do you see in this home? What would be some concerns you would see looking at this picture? Anybody?
Baby,
Smoke.
baby is laying next to an outlet that could be plugged in or not plugged in, electrocuted very easily.
Yes.
There are cleaning products in the space very close to the baby, but just out in the open.
Yes. I see cigarette smoke, bugs, clutter, exposed chemicals, parents not being attentive, chaos. Lots of people on electronics instead of engaging, old food. Definitely, we're seeing some things we need to be concerned about in this picture. TV could fall over. That's a big one. I think that's the first time I've seen that one, Lori. Now I'm going to ask you, what protective factors do you see in this picture?
Well, based on the picture on the wall, there is a faith connection.
Yes, there's some type of faith. I see toys. There's a book. We have a playpen. All the children are where they can be seen and supervised. There is food. Books. Okay. They appear to have clothing. There's pets and a home.
Mhm.
Yeah.
And while it is chaotic, the children seem to be calm.
Yes. There might be a lot of clutter, like you said, a lot of kind of chaos, but kids are there. We have an adult present.
Other than the child in the playpen who's requesting more attention.
Yes. Okay. Thank you all. I'm loving this. There's going to be a lot of time for you all to interact with us throughout the day. So thank you. We're starting strong. I'm looking forward to seeing how this plays out for us. So what this activity showed us. Here we go. There we go. So we're going to start today by the process of cognitive reframing. We're going to challenge your brain to lead with the positive so that seeing strengths becomes part of our type 1 thinking. So I'm going to ask Ben to launch our first poll of the day. And if you'll just answer, well, go ahead and answer them all, I guess. Or the first one, if you can just do that. Was it easier to see the risk factors or the protective factors? Or was it about the same for you? You were able to notice both. And Ben, when it looks like we have about everybody answered, if you want to launch those results, that would be great.
I think it looks like who's going to answer is answered if you're ready to launch.
Yep.
Don't see a launch here, but about
Okay.
75% said risk factors were easier to see, 3% said protective factors were easier to see, and 22% said they were about the same.
All right. Thank you so much, Ben. So like we said, there we go. It launched up. So risk factors were easier for most of us, right? And we're going to talk about why. Our type 1 thinking is fast, intuitive, unconscious, and based on training and experience. So that's where most of us come from, that social services field, right? We are trained to kind of go in and identify those risks. That is our type 1 thinking coming into play. Our type 2 thinking is slow, it's calculated, conscious thought, and really involves novel concepts and ways of thinking. So for most of us, finding the risk factors in the picture really involves that type 1 thinking. Whereas when I asked you to look for those protective factors, it required that type 2 thinking to kind of click on. And what we're hoping to do through today, and as you progress on, is with practice, finding how to ask those protective factor questions, labeling those protective factors are going to become more natural and an automatic thought. So type 1 thinking is laden with implicit bias. It's our gut reaction, which also grows from cultural and personal biases our brain has processed over time. We all have them. But slowing down our thought process and using type 2 thinking can really help us notice and navigate those biases. Slowing down allows us to consciously focus on strengths, and instead of making snap decisions that are based on risk and challenges. I'm going to turn it over to Miss Kimberly Ladd to introduce you to Hope.
Hello and good morning, everybody. Thanks for having us. Welcome to Healthy Outcomes from Positive Experiences. I'm Kimberly. It's such a pleasure to be here with everybody. Before we dive in, I just want to take just a moment to acknowledge that this presentation was developed in partnership with the Hope National Resource Center. And I think we have a slide up for the Hope NRC, do we? There we go. Yeah, there's all our folks. So the Hope National Resource Center is based out of Tufts Medical, and they serve as a central repository, if you will, for research, guidance, and the dissemination of hopeful best practices. The team has graciously provided foundational support to the Resiliency Project, as well as other collective impact partnerships like ours across the nation to promote positive childhood experiences, strengthen child and family relationships, and really improve that grassroots collaboration and care coordination on the ground, if you will. And together we seek to inspire a hope-informed revolution across the nation that fundamentally transforms how we advance health and well-being in our families and communities. Next slide. So by taking the time to learn about hope today, you are becoming a part of a movement that seeks to not only shift how we see and talk about the experiences that matter so much, but also seeks to shift the way people who engage with children and families deliver care and services. At the service level, this is an intentional shift away from a sole focus on those risks and deficits towards embracing a growth mindset, if you will, with families that really prioritizes child and family strengths and protective factors. At the systems level, this is a shift from narrowly focusing on risk and safety towards encompassing a broader social ecological perspective that really supports the well-being, again, of both children and families. And as such, this really requires cross-agency, cross-sector, and cross-systems collaboration to ensure long-term sustainability. Next slide. So why are we here? Why does hope exist? Well, hope exists because we now know positive experiences can really help children grow into more resilient, healthier adults. And in partnership with the Hope National Resource Center, we really want to get the word out so that others know just how important these positive experiences are and that they are just as critical to adult outcomes as adverse experiences are. And again, together we hope to, if you will, hope, engage me there, to better understand and celebrate the growth of these key experiences as together we engage children and our families, schools, communities, and systems of care. Hope is founded and grounded on the core assumption from the Science of the Positive from Dr. Jeff Linkenbach at the Montana Institute, which states that the positive exists, it's real, and it's worth growing in ourselves, our families, and our communities. So I think that we know intuitively, and now, thank goodness, we have research to back it up, that positive experiences are important. We know that they do a ton of things during the early childhood 0 to 5 period, but they also work throughout the lifespan, so that not only do they promote children's health and well-being, we'll of course talk more about that research as we go on, but they also allow children to form strong and meaningful relationships and connections. They cultivate confidence and positive self-image. They provide a sense of belonging that allow kids to really know that they matter. And they work to build coping skills so that kids can move throughout the stress that inevitably will happen at some point. And as we've learned, which is really exciting, is that positive childhood experiences actually do protect future adult mental health. And yet, as a field, and you can really take that for whatever field that you may be working in personally, whether that's child abuse prevention, family support, pediatrics, maybe I do think we have some home visitors here. Through our systems and our assessments and our screening tools that we use, we can really tend to focus on the negative. We're often trained to screen for problems, if you will, to look for those gaps that need filled. So with hope, we're hoping, if you will, to shift the narrative here a bit so that not only are we recognizing gaps, that's definitely still important, but that we're also really being intentional to take the time to lift up what's going well with families, to see families holistically so that they're not just defined by the challenges faced, but they also get to bring their strengths to the table as well. So here's where we go from what's wrong to what's strong, if you will. All right, and I'll pass it back to you, Rachel.
Before we start, I want you to take a minute and think about someone you know personally or professionally who had a challenging childhood.
Hello.
There we go. Thank you. So take a minute and think of somebody personally or professionally who had a challenging childhood, but is fairly successful today, somebody you would think of. And in the chat box, if you want to just, what are some adjectives you would use to describe that person? Resilient. That's a good one. Lots of resilience. Motivated, reflective, confident, determined, brave, adaptable, courageous, determined, compassionate. All beautiful words. Caring. As you continue to share those adjectives, for those who don't know, we have Miss Viola Davis pictured here on this slide. Viola came from a childhood of poverty, stricken with domestic violence between her parents, instability, talking about knowing that she was going to sleep and hear the rats at night at her blankets and at her toes, wearing the same clothes, and often being bullied at school. But one outlet for her was school and the teachers who took interest in her. They saw a gift in her and encouraged her to continue pushing through and to seek acting as a career. We know Viola now is not only the leading actress, but she also just recently became the 18th person ever to achieve an EGOT, which is an Emmy, a Grammy, an Oscar, and a Tony. So we know that these things we know that we can overcome it with that resiliency. So I want you to keep that person in mind that you thought of as we transition through this presentation. I believe we already had these polls come up, but I know this great state of Tennessee, we have done a lot of education around ACEs. Okay. So we're going to talk just briefly about some ACEs and can start to bring in PCEs. So compared to the 2015 PCE study, the original 1998 Adverse Childhood Experiences study that was done by Vincent Folletti and colleagues compared survey results from over 17,000 employed HMO members. The survey gauged their current mental health and physical health, tying to adverse childhood experiences to negative health outcomes. We know those adverse childhood experiences fell into 3 general groups: child abuse, child neglect, and household dysfunction. As this slide shows, child abuse includes physical, emotional, and sexual abuse. Neglect includes physical and emotional neglect. And household dysfunction is based on items including adult mental illness, domestic violence, excuse me, parental divorce, an incarcerated relative, or an adult in the home with substance use disorder. Each of these 10 kinds of experiences is labeled an adverse childhood experience. A person's ACE score simply reflects how many of these types of experiences a person had. For example, when adults recall that they were emotionally neglected or their mother had a substance use disorder, that would have been an ACE score of 2. ACE screening is becoming more prevalent across the country as a way to screen for childhood trauma. We also know that broader social and community issues contributed to ACEs. This is illustrated in the Pair of ACEs tree by Dr. Wendy Ellis and Dr. Bill Dietz at George Washington University. This work adds on social effects, including poverty, institutional racism, historical trauma, and the effects of war and migration, and neighborhood effects as the roots of most ACEs and in of themselves adverse childhood experiences. This understanding of ACEs takes into account the reality that many ACE scores result from systematic and institutional racism outside the control of an individual family. Consider the adverse childhood experiences of an incarcerated relative, which reflects the mass incarceration of young Black men in the United States. While having an incarcerated parent would give a child an ACE score of 1, the root of that score could be attributed to institutional racism far more than it could be attributed to a deficit stemming from that particular family. April?
Thank you, Rachel. And I'm gonna thank you for your patience ahead of time for my scratchy voice, which I'm super grateful for, because that means Tennessee is going to be really beautiful in a few weeks. So what can we do to address these adversities that Rachel was sharing about? These building blocks that you see here describe the key types and sources of positive childhood experiences that are critical for optimal development. And many of you know that adverse childhood experiences can disrupt access to positive childhood experiences. For example, here, child abuse disrupts access to the first 2 building blocks, which are relationships and safe environments. And when we see the child holistically, we can really begin to see how their adverse childhood experiences might be preventing them from gaining positive childhood experiences in certain areas. And as providers, we can work to increase a child's access to those building blocks where they might have experienced a disruption. And these experiences include nurturing relationships with peers, caretakers, and other adults, safe, stable, and equitable environments in which to live, learn, and play, social and civic engagement, and opportunities for social and emotional growth. Next slide, please. So let's talk about how positive childhood experiences can help create this revised definition of health and protect adult mental health. Do we have the poll launch so that people can respond about how much they know about positive childhood experiences?
Maybe we just need to put it in the chat, April, like ABC.
There we go.
Okay,
Oh, here it is.
Okay, this one was, how much do you know about adverse childhood experiences? Let's see.
If you scroll to the bottom, we have 6% said nothing. What are PCEs? 6% said a little. 63% said more than a little, but probably still have a lot to learn. 25% said I'm well versed in PCEs, and 3% said I'm a PCE expert.
Okay, so we have some varying knowledge bases there. I appreciate your patience. For those of you who are experts are very well versed, because some of this may be repeat information for you. Next slide, please. So thank you everyone for sharing about your knowledge on PCEs, and I'm going to ask you to think about a positive experience that stands out to you from your childhood. And if you can't think of a positive experience from your own life, then if you could think of a positive childhood experience you witnessed in someone else's life, and just hold that in mind as we talk, please. Next slide. So let's start by talking about the new science, which shows how positive experiences affect health. In 2015, in collaboration with Drs. Peter Pecora, Jennifer Jones, Bart Klicka, and Dr. Jeff Linkenbach, Dr. Robert Sagi at the Hope National Resource Center sought to better understand how positive childhood experiences correlated with adult health. And just plugging in here that Dr. Sagi will be at the Resilient Tennessee Collaborative Summit on May 10th. So if you would like to hear his keynote and hear more from him about his work, then I believe TCCY is sending that registration around. So the team added 7 questions about different types of positive childhood experiences to the Wisconsin Behavioral Risk Factor Surveillance System Survey, or BRFIS as we call it. And the BRFIS, as some of you know, is a telephone survey conducted in all 50 states that collects data in the United States on residents regarding their health-related behaviors and chronic health conditions. And we specifically looked at 6,188 surveys conducted in Wisconsin that gathered this data on positive childhood experiences. Next slide, please. We then looked for correlations between how participants answered these questions and their reported mental health status as adults. And positive childhood experience questions asked how often respondents felt able to talk to their family about feelings, felt their family stood by them during difficult times, enjoyed participating in community traditions, had a sense of belonging in high school, felt supported by friends, had at least 2 non-parent adults who took genuine interest in them, and felt safe and protected by an adult in their home. And you'll see here that the word felt is used quite often. So they really did focus a lot on the perception of the respondents as to whether or not these things were accessible to them. Next slide, please. And what we found was very astonishing. We found that positive childhood experiences protect future adult mental health. Participants that reported having 6 or 7 of these positive childhood experiences had a 72% lower chance of reporting depression or poor mental health as an adult when compared with individuals reporting 0 to 2. And even when individuals reported only 3 to 5 positive childhood experiences, when compared with those reporting 0 to 2, they still had 50% lower odds of depression or poor mental health in adulthood. Next slide, please. We know that positive childhood experiences help build resilience, which leads to positive health outcomes in adulthood. So let's talk a little bit about what we mean when we say positive childhood experiences, especially in the lens of the HOPE framework. The HOPE framework consists of 4 evidence-based building blocks, and we talked a little bit about those previously. But these building blocks describe the types of key positive childhood experiences that are critical for healthy development. And this framework was developed and described by Dr. Charlene Harper Brown and our HOPE leader, Dr. Robert Sagi, who I mentioned earlier, in a paper published in Academic Pediatrics in 2017. And in that paper, Dr. Harper Brown and Dr. Sagi distilled key themes across a variety of publications, and resulting in the 4 broad categories of positive childhood experiences, which we now refer to as the building blocks of HOPE. And these building blocks are relationships, environments, engagement, and opportunities for social and emotional development. So now I'm going to ask you to reflect back on your own positive experience that you had as a child, or someone else's that you witnessed from earlier, and just pop in the chat box if you're comfortable which one of the 4 building blocks it related to. And you can list any that apply. If you feel that it relates to more than one building block, then list whichever ones you think apply. And Rachel, I don't know if you were able to share the 4 building blocks on the screen so that in case people need a reference.
In the chat box, I'm seeing relationships. More relationships. Safe environment. Relationships with other children. Most of my best experiences were with my friends. Environment, safe, equitable environments, emotional growth, stability within my nuclear family, relationships, safe environment. Relationships, parents and grandparents did lots of day trips on the weekend.
Appreciate you guys sharing that. And the grandparents reminded me that, the positive childhood experiences are, one of those is that those relationship with non-parent adults, and grandparents is a perfect example of that. And just a really good example about how we can support children in developing positive childhood experiences without being a parent to that child or those children. So let's return to the results of our 2015 Burford study that looked at PCEs and adult health outcomes. And you can see here that the protective nature of positive childhood experiences remains even in the face of adversity with adverse childhood experiences. And you can see in those adults who reported 4 or more adverse childhood experiences, when exposed to an increasing number of positive experiences, the rate of adult depression or poor mental health outcomes decreases. And these results exemplify the protective nature of positive childhood experiences. Next slide, please. We know that adverse childhood experiences contribute to toxic stress, which has shown to lead to poor health outcomes when left unmitigated. And we also know that positive childhood experiences protect against and likely disrupt the harmful health effects of toxic stress to promote healing and build resilience, which leads to improved health outcomes.
Thanks, April. So let's let that really sink in. Positive childhood experiences protect adult mental health, even in the face of adversity. So we know that we can't always stop the ACE, but we can indeed always promote positive childhood experiences that have a clear protective nature. And here's where I like to remind of a quote. Actually, I've heard Dr. Gabor Mate say it. I've also heard Dr. Peter Levine say it. Trauma isn't what happened to you, it's what happens on the inside in the absence of an empathetic witness. And I think this quote really speaks to the beauty of the power of presence and the simple act of being with someone amidst the challenges, that is in itself a healing balm for the soul. So I think as people who get the opportunity to work with kids, I hope it's really empowering to really recognize just how much of an impact positive experiences really do have on children, and that it, again, is indeed within our power to create these moments of hope in a time where certainly hope is probably exactly what we need more of. So with that said, we now have a piece designated in the presentation where we can, sometimes we break out, sometimes we can just stay here in this room. I think that's what we're going to do. But let's talk about ways that you may already be promoting access to the building blocks. Thank you, Rachel, for having that slide up there. Relationships. How might you already be promoting access to relationships? If you want to come off mute, or if you want to throw your responses in the chat, that would be fine too.
We sponsor family engagement opportunities in the local schools where parents can come in and participate with their children in activities that they either may not have the resources for or the opportunity to plan.
Right. Anyone else? What about environment?
Our schools are school-based when it comes to outpatient counseling, case management from our local community service board. Also, the agency Communities and Schools, who Amy just spoke and represents, works directly with our students, all students through tier 1, but also drills down and works even more closely with students on their caseload and like a tier 3 type approach. So bringing multiple agencies to the table, but working inside the school building to kind of create that community school model has definitely been a part of that environment piece for us.
And Kimberly, in the chat, Leslie said, I always try to build upon the parents so that they feel confident in their abilities. Jill said, as a pediatrician, it is part of the Bright Futures guidelines to assess and promote early relational health. Brandy said, we train and certified caregivers to provide care and love to children on removal day by DCS entering foster care. We also provide a safe and clean, beautiful home to stay at while waiting for placement with abundant food and new clothing.
Beautiful. Great, thank you. What about social and civic engagement that helps children develop a sense of belonging and connectedness? What do we have there?
I think a lot of it goes to the type of culture that each classroom is established and the type of relationships that our teachers build with our students to promote that engagement and make them feel safe to raise their hand and create that safe space for them to be vulnerable in order to make mistakes in the classroom, because we all know learning can't happen unless a kid is willing to make mistakes and put themselves out there, and that can't happen unless they feel comfortable. So that engagement piece is really a culture builder by the training and the support skills that we have from our teachers.
Oof. Great points.
I think our community groups like Girl Scouts, Boy Scouts, we also can't discount the importance of working with churches that sponsor youth groups who do community civic projects in their community, where they give back, not just take.
Leslie also said in the chat, community schools are amazing. Pond Gap Elementary and Knoxville is a perfect example. I'm not familiar with Pond Gap. If you want to elaborate, that would be amazing.
Now we want to know.
I know, now I want to know, so if somebody knows.
Hey, sure, it's Leslie. I'll be glad to tell you about that.
Okay.
So, one of my favorite things about Pond Gap was that after school care was included. So the parents didn't have to worry about trying to pay for that. And they had this really cool class called Circus, where they taught the kids how to like ride a unicycle and just very, very cool, like out of the box types of things. They also did a lot with diversity because there's kiddos from all over the world at that school. So they would just do lots of different things to spotlight different cultures and communities. And I think it just does a lot for the kiddos because nobody felt like they didn't belong.
That's amazing. I'm going to pack up and I'm going to enroll in school. That sounds like fun.
Yes, I don't work there anymore, but I loved it. And just seeing the kiddos thrive there, it really was a beautiful thing.
Thank you, Leslie.
Yeah, sure.
Yeah, and it's amazing how much it goes for the adults too, right?
Yes,
All right.
that's a really good point. That was my first time in a school environment. I'm a social worker, but just seeing those teachers, they just loved those kids. And you know, it was elementary, so if you needed a hug, like you were going to get a hug that day. And a lot of those kiddos are living in poverty. And Pond Gap even had a program where they would do this thing called backpack buddies. and they would send food home with the kiddos on Friday so that they would make sure that they had snacks and stuff for the weekend. And they also did that in the summer too, because I think, anytime you can meet a kiddo where they are and address all those basic needs, like you're definitely doing something right.
Yes, Leslie. Yes, yes, yes. Thank you, thank you, thank you. Anybody else before we move on? All right. What about opportunities for social and emotional growth? That opportunity to develop a sense of self-awareness and social cognition, regulating our emotions. What do we have for opportunities for social and emotional growth?
Communities in Schools is working with Sesame Street,
Ah,
and in Dickinson County, we are running a multi-year social emotional learning program with all the students in the building based on the concepts that Sesame Street provides. And not only do we engage the students with the concept in the classroom, we promote it throughout the school building with bulletin boards and announcements and activities, but we do a send home to the parents discussing the social emotional concept and then providing them an activity to do with their children in the home. And then what happens is when they return the completed activity, the parents have the opportunity to enter into prizes and raffles and things like that to make sure, we might have to hook them in the beginning, but over time they begin to see the importance of what we're doing. And it's been so successful that the school system has asked us to go from once a month to twice a month
all right.
moving forward.
Well, Amy, that sounds like a win.
Listen, it is really fun when we plan those lessons. Who doesn't love Elmo and Abby Cadabby?
I know. I was just thinking, Elmo helps me name and label my emotions. Of course. I love it. I love it. This is my favorite. Okay, thank you, Amy. Anybody else?
In the chat, we have, again, Pond Gap. They have a garden that the kids work in. The school shares their harvest with the community. The kiddos take a lot of pride in it. And then Jill said, discussing parenting skills that promote positive social emotional growth at well visits. Observation of the child caregiver dyad is important and can provide cues as to what needs to be discussed. Wallace said using inductive parenting practices.
Excellent. Great, great, great responses. Anybody else? Okay. Well, that was a great exercise. That filled up my bucket. How about everybody else? All right. We'll go on to that next slide. So here we have some discussion time. Anything surprising? Do you think there's maybe some building blocks that are easier to connect to, or do you think maybe there's some that might be a little more difficult to connect to? Any thoughts? Okay.
I'd say it probably
Okay.
depends on the community and the people that you have. I mean, I would say there's probably not a general answer to this. We're all dealing with unique communities and unique skills within our buildings and our staff. So, and the challenges that our students bring are unique to each community. So, yeah.
Very good point, Dr. Will. You're absolutely right. It really depends upon the community that we're working with. All right.
I think one of the biggest challenges is parents who want to ensure that that we keep our hands off kids' emotional development in the classroom. We focus on, reading and writing and arithmetic, but don't dare talk to my kid about how to think or feel. I don't know how widespread that is in school systems, but I do know that frequently that's what you run into as a parent who doesn't really understand that reading, writing, arithmetic doesn't happen without emotional balance in the first place. And so I think that's just a general challenge to display to the community.
And way too many teachers who don't understand that either, unfortunately.
I worked at an elementary school where they did responsive classroom, and they did the morning meeting and then the afternoon meeting. And unfortunately, sometimes when we provide these services, if we can only make it look like play and good times to the parents, then I think that's one way that we can make parents more supportive of us using that time to help their children understand about their emotions without parents feeling attacked. And unfortunately, that's something we have to contend with at most places.
Melanie says another challenge I've run into is older parents, grandparents who say, well, I survived my ACEs. This feely stuff is making our kids too soft.
Yeah, and I think that's where a lot of our teachers come from who don't understand the value of maybe looking at it through a different lens. Is where I got to this point in my life by, just sweeping everything under the rug. Trauma was never a term that we used in our term. Mental health was never accessed for our generation. So, and I made it. I pulled myself up by my bootstraps. If you're given all these supports, then you won't have the capacity to pull yourself up by your bootstraps because you were given a handout, and that's a philosophical battle, guys. And that's across the board everywhere. I mean, and until you experience your own adversity, until you're humbled yourself, there's some individuals, adults, teachers of both, that will struggle to understand that.
Yeah, I think that's right on, Dr. Will. And it's not just a Southern thing. Melanie said she agrees. All right, good stuff. Good discussion. Thanks, everybody. Let's go ahead and move on back to that next slide there. And let's call to mind again the person that you thought about earlier, who had a challenging childhood. What do you think their positive childhood experience or positive experiences were? What do you think their positive experiences were?
Strong relationships with non-parents.
People supporting and investing in them. People. Teachers who took interest.
Yes, those relationships are that variable, right? Sure.
Thank you.
People seeing the best and having grace with the hard. Ooh, Brandy, that's good. Grace with the hard. Dr. Will, knowing each student by name and understanding their strengths and culture.
We have about 8 minutes left, so we probably need to move on from this good discussion.
So on the next slide, I do want to mention here, HOPE is not a manualized evidence-based practice. It's a framework, and it's, again, grounded in the principles of strength-based, child-centered, family-led care that really seeks to promote access to these key positive childhood experiences within the building blocks that we've just described. And hopefully, because it is a framework, it can be easily layered into and integrated into the work that you're already doing. And now I'll hand it back over to Rachel.
All right. So what makes HOPE unique is the focus on the child. This fits well with other models that many are using to promote strengths and protective factors. While HOPE can be used to look at policies and community efforts, the aim is to increase access to the PCEs for each individual child. HOPE also bridges together many frameworks that are already out there in the field, including the importance of relational health, a focus on social determinants of health, and child-directed play, and supporting parental well-being. We have also heard, and the HOPE NRC is currently working on formal research studies around this topic, that HOPE reduces burnout. Most of us did not go into this field because we feel families are broken. Yes, we can spend our days screening for risk and talking about what's wrong, but we're here because we believe in the strengths and resilience of children and families. HOPE allows us to return to our core beliefs and gives us research to back up the idea that we felt was important intuitively really does make a difference long term. And finally, HOPE aims to promote human dignity by seeing each person holistically, not just as a list of their problems and deficits. The HOPE framework encourages providers to push back their intuitive type 1 thinking about the child and family in front of them and see all of the wonderful attributes and resilience that brought the family to where they are today. And at its core, we believe that families and children are resilient. And we seek to take every possible opportunity, whether that's through our initial contact with the family, through intake processes, screening forms, treatment planning, or organizational policies, to really celebrate those strengths. And we know that we can share these moments of hope at any given time, through each encounter with a family, during intake and assessments, when sharing even referrals with our community partners or with community resources, when creating or revising policies, or when designing programming. We know that that is available and we can share those moments at any time. April?
Thanks. So there's a lot of resources on the HOPE website at positiveexperiences.org. So if you want to check that out and download what seems helpful to you, if there's ever any materials that you'd like to adapt for your organization, you can reach out to the HOPE team. They're always willing to co-brand and work with organizations to make meaningful resources. We've co-branded tons of their materials, and they kind of feel the same way we do. They just want to get the message out there and really saturate Tennessee with this framework so that we can all have that common language to promote positive childhood experiences. And next slide, please. So I encourage you to learn more about HOPE and share the framework with your colleagues and just go deeper. And again, that website is positiveexperiences.org. Or for more information, you can email hope@tuftsmedicalcenter.org. Next slide, please. We wanted to take just a few minutes. I see we have 4 minutes left to share how we've incorporated HOPE into our work. In 2014, I formed the Healthy Start Community Action Network and began developing action teams based on data and the shared goals of the members. And our latest collective impact team, the Resiliency Project, formed in 2021, was created by combining our former Adverse Childhood Experiences Knowledge Mobilization team, our Racial and Ethnic Equity team, and the Neonatal Abstinence Syndrome Prevention team into one group to become the Resiliency Project, with the idea of shifting our focus to growing what was going well in our communities and building strategic plans on promoting positive childhood experiences, and while keeping that parallel process in place that we had used before that could be applied to individuals, communities, and systems. By working on upstream wellness, we really feel that we can address the issues of ACEs, NAS, equity, and so many of our other collective goals. So the existing members of the action teams were folded underneath the umbrella of the Resiliency Project backbone by Centerstone, and where we all came together. Next slide, please. So the Resiliency Project is our initiative, mission, in response to the latest brain science on ACEs to grow upstream wellness by cultivating hope for Tennesseans through collective impact and community engagement. There's not any specific funding tied to this or scope of services. We've kind of piecemealed it together based on whatever funds were available to us. And Centerstone has been kind enough to let us use funds from the Healthy Start Tennessee grant to support some of this work. And over the last 2 years, the project has intentionally convened parents, coalitions, community partnerships around the importance of healing-centered family engagement and the importance of growing those positive childhood experiences that promote resilience and aid in recovery across the state. So we meet monthly for networking and collaboration, where we can gather around the data, research, science, stay emergent with tools and trends, collectively learn and share best practices as we work toward that shared vision and common language for hope in Tennessee. And we use the science of the positive cycle of transformation, which you see here on the slide, beginning with spirit, to think about what is the spirit and tone of our work, what is our why. And here we really look to what's positive and what's hopeful. And this gives us that sustainable energy and just really breathes life into the project. From there, we move on into the science and ask questions like, how will we approach the science? What's the role of the data? What are we trying to learn? What questions do we need to ask? And here we can really have conversations about the effectiveness of the science that can lead to those best practices that we are hoping to push forward. And then we can think about action in terms of best practices, integration, and bringing things together. And thinking about where will our focus be, where are we placing our energy in terms of policies and practices. And here we really spend a lot of time also talking about transformation. And then coming back full circle to return, where we complete the cycle to rest, reflect, and evaluate our efforts and ask ourselves, are we seeing a return on our investment? And just really thinking about our work together. And this cycle of transformation really helps orient us towards what's possible, working to transform that traditional risk frame that so many of us are used to a gain frame, and setting that stage for transformation. Next slide, please. Our 3 goals right now are to provide community education, equitable promotion of protective factors to increase positive childhood experiences using family-centered approaches, and increasing equitable access to services and supports that promote positive childhood experiences. Next slide. And to support these goals, Centerstone paid for the Resiliency Project partners and Centerstone staff to be trained by the Healthy Outcomes from Positive Experiences National Resource Center as hope facilitators, who are now certified to deliver hope workshops. And 2 of our project partners are certified hope champions now, meaning they can go beyond hope training to deliver more in-depth technical assistance and policy support to guide implementation of hopeful practices. Centerstone's evidence-based home visiting, Healthy Start Tennessee, HRSA-funded staff, and other early childhood service program partners receive Science of the Positive transformational leadership training and follow-up coaching from the Montana Institute. And we also sent Resiliency Project partners and internal staff to attend the 2022 Summer Institute hosted by Montana Institute, where they gather annually around Science of the Positive, and people come from across the globe to learn the latest in research, programs, and effective positive community norm strategies to grow those positive health outcomes. And Resiliency Project partners and staff receive regular and ongoing continuing education in the HOPE framework and positive community norms process. In addition, we sponsored HOPE, Science of the Positive, equity trainings, which we made available for free to the public. HOPE trainings are also provided free of charge by Centerstone in Marshall, Wayne, Warren, Van Buren, Jackson, Fentress, and Moore counties. And we have more people getting trained, so we'll be able to open that up in 21 counties. And then we also have Kimberly Ladd here with Align Hope, who's available to provide HOPE trainings and TA without any of those geographic restrictions upon request. Next slide, please. So to prioritize the equitable promotion of protective factors and the access to services that promote PCEs, we've got a growing group of parent leaders who are trained HOPE ambassadors. And these are parents committed to applying HOPE within their own lives and families, who also have the desire to share this work with other parents and lead change within our larger communities. And we also currently work to enhance our partnerships with faith-based communities and have recently pulled in Tennessee Department of Mental Health and Substance Abuse Services faith-based community coordinators to maximize our impact. In addition, we sponsor trainings on diversity-informed tenants for work with infants, children, and families to include agency staff such as Aim High Tennessee, TCCY, and other third-party networks with a wide reach. And the Tenants Initiative envisions a workforce in which all individuals, programs, organizations, and systems of care embed principles of diversity, equity, and inclusion into their work serving infants, children, and families. And Centerstone is an endorser of those tenets through embracing and promoting the tenets to support the health and well-being of all infants, children, and families as a part of our diversity, equity, and inclusion journey. So moving forward, we will also be collecting data on racial and ethnic resiliency factors on which we can build our collective impact efforts to further promote positive childhood experiences.
Quickly, I was just going to mention how we share HOPE through our Healthy Start Tennessee program. We are funded through HRSA, and we start with the initial engagement with the family by seeking their spirit. What is it they're seeking out of the program? Why are they here? And really taking time to get to know their story. We know they are the experts of their home, their family, and their traditions, and we want to meet them where they're at. So we do that while getting our required paperwork done, but also taking a wide lensed approach on seeing the family's whole being by seeking out each of their building blocks of hope. What do their relationships in and out of the home look like? Do they have a safe environment? What does their engagement with the community look like, as well as their emotional needs? We then continue that parallel process into our staffings with supervision on how do we identify their strengths and how do we build upon those to address any needs or deficits we may have identified. Healthy Start Tennessee also regularly seeks opportunities to build community engagement and belongingness through groups and classes. At this time, we are offering incarcerated parents as well as parents in local rehab centers, parenting classes that we do in person with them, where they get a chance to learn how to just be parents, right? While we're in a tough situation, but how can we take these skills back home? We also offer virtual prenatal classes, and as well as have routinely have events in the community. Our therapeutic services focus on individuals as well as the family dyad, and that really helps us to bring in the family unit to address attachment and bonding. And we work internally to get to know our staff as well as their interests and strengths. We pull upon those for various opportunities as we arise, and seek new opportunities to expand our services in the community. And a good example would be during the pandemic when we moved home virtually. We asked each of our staff, what is it something you're interested in? And that led to us offering a virtual menu of classes, including cooking classes with your kiddos, painting, stress management, yoga, and mindfulness. But it pulled on those strengths of our staff and how we could engage our families.
Thanks for hanging in there, y'all. To center and grow hope-informed parent leadership, Aligned Hope was born in 2022. Aligned Hope is a parent-led nonprofit organization growing family voice and choice through hope-informed advocacy, education, and collaboration efforts that inspire upward mobility and multi-generational well-being. Because we believe that parents are the experts of their families and communities, and as such, should be actively included and meaningfully involved in all levels of policy and decision-making. Parent leaders are a valuable asset to our family and child serving agencies and organizations, and as such are really central to shifting the narrative to hope-informed practice. So as such, we train parents in hope-centered leadership, organizing, and capacity building skills to advocate and influence policies and decisions that impact the lives of children, youth, and families. We also have a growing group, as April mentioned, of parent ambassadors that provide training on the HOPE framework, as well as are able to provide that follow-up technical assistance and implementation support to organizations who are ready to put hope to practice. And we've also been fortunate to have partnered over the past 4 months with the Hope National Resource Center to participate in a 6-month cohort with other Hope practitioners across the globe. And our focus has been on piloting a new organizational certification that we'll soon be using to guide other organizations as we work toward a Hope-informed Tennessee. And of course, as you can see there on my screen is my contact information. I'd love to connect with anyone in a follow-up conversation that would be interested in working more with hope in your world. Next slide. All right, so we've talked about why hope exists. We've talked about the research and the science and the application of hope, the 4 types of positive childhood experiences that seem to have a specific effect on adult outcomes, and what this means to us as parents and professionals. So I know that we are really buttoned up against time now, but want to see if anybody has any questions. Thoughts, questions, or feedback?
I think you need to tell Resilient Tennessee that you really need 1.5 hours because you really have I mean, it's all the right information that you really need with the application for programs and individuals. So I think that I would just tell Melissa McGee you need more time because I can't see anything that you could cut out of it. It was really helpful to know the concepts and then how it's applied, in organizations, and then, like this great work with the parent led groups. So I don't think you can cut out anything.
Great feedback. Thank you. All right, please do complete the survey. I think a survey was put in the chat box. If not, it's there on your screen. You can simply take a picture, give us your feedback, your thoughts and suggestions. And thank you so much for this wonderful opportunity.
And Kimberly, is it okay if we get your PowerPoint and share it as a handout with participants? They were asking us, and I think we forgot to ask you ahead of time.
Well, I'll have to check to see what the policy is with the Hope NRC. Does it, right, April or Rachel, do either?
Yeah, we're able to share any of the resources that we co-branded with them as long as people don't train on Hope slides. So if they're branded by Hope, then they just have to have that certification to share.
If you share it with us, we'll make it a handout, not as a PowerPoint, but as a handout, a PDF. So
perfect.
Thank you.
Wonderful.
Somebody asked how do you get certified. I can send you that information if you email april.scott@centerstone.org. I can send you a link.
I put all of our emails in the chat as well, all 3 of us.
You're welcome.
Again, we thank you. We thank Ballad Health for having us. And we look forward to having more hope conversations with you all.
Yes, thanks so much for being here and presenting for us. And I'm hoping that you get the, I know when April and I talked, it was like, we got to get this out there. We got to get more people doing this work. So I hope that we get that outcome for you too, April. So thank you again for your time and bringing this great work to us.
Appreciate it.